From 2017 till date, over 1 million Deltans have been enrolled in the Delta State Contributory Health Insurance Scheme. Hello, I'm Henrietta Enwerako. On today's edition of Smart Delta, we shall take you through the advancements made in the healthcare delivery in Delta State through the health insurance schemes. We shall also bring to your viewing pleasure the very low rate of infant and maternal mortality, largely due to the state-free medical charges for under 5, prenatal delivery, and postnatal services. Stay with us.
For several decades, the high costs associated with access to healthcare services has remained a global challenge. The global response to this challenge gave rise to the Universal Health Coverage, a robust health financing mechanism that protects vulnerable persons from financial hardship. In Nigeria, the poor state of infrastructure, lack of medical equipment, and even proper staffing of health facilities has hindered not only access but also the quality and effective healthcare delivery. While this reality is worrisome, Delta State government is, however, changing this narrative as Governor OKOWA has been busy transforming his corner of the world and ensuring a healthy populace with the establishment and effective implementation of the Contributory Health Insurance Scheme.
We've been able to lay a start, have a law, get the thing running, and the government has continued to fund it for the very vulnerable segment, which is all pregnant women and all children under 5 years of age. We have been able to fund the premiums, and it has worked well. So we are impacting on the lives of the family economy of each of these families that make up these communities, and that is very key to us. Other people are getting engaged, and we're hoping that we will continue to encourage private individuals at a very low premium.
The current governor, he has in-depth knowledge about health and the healthcare delivery system in the state. The Healthcare Commission, for example, that has not had any state in this country that have been able to reach the feat already attained by this. His dream is to leave a legacy of a healthcare system that generations yet unborn will be proud of.
This policy thrust of the OKOWA-led administration in the health sector is to ensure access to quality healthcare services for all residents of Delta. Since the rollout of the program in 2017, it has seen the registration of over 1 million enrollees benefiting from this well-thought-out scheme.
So far, we have been able to cover close to 20% of Deltans. Delta population is about 5 to 6 million. By now, we have crossed a million line. National health insurance have only covered 5% of the population and mainly civil servants. But here we have covered in less than 5 years, well close to 20% of Delta are in the health insurance scheme.
This contributory program has been running, like in my facility where the first set that started. It's more than 4 years. Rendering services to persons that are pregnant free, treating of under 5 free. It has really helped so many people that could not afford treatment, because there are some people you will not know they can die because of just paracetamol at home. But with these services that the governor started, he's a laudable one, and I just want to appreciate him.
Due to the high rate of neonatal, child and maternal mortality in Nigeria, the Delta State government pays premium attention to pregnant women and children under 5 years of age. This has improved the health indices, reduced child mortality and morbidity to their barest minimum, and significantly reduced the challenge of out-of-pocket payments for residents of Delta State.
Since I've been coming here, the nurses, they have been okay, they are nice. You are not paying for anything. Everything we do here is free.
Since I came for registration and today antenatal, I have not spent 10 naira for anything. The lab, the scan, the registration, everything is free. I thank God for the governor, Dr. OKOWA. I pray that God will keep him and bless him more.
I actually enjoyed more attention in this hospital than the one I registered in before now. I have not paid a dime ever since I registered here. And the most interesting aspect of it was I did a free scan, which would have cost me like 3,000 to 2,000 naira normally. So it has been very beneficial.
Mothers are appreciating it. They are happy with the program. So when they come to this facility like this, they go home with their drugs, everything free. As they go back, they always say, God bless OKOWA for this wonderful scheme he has given to us.
Speaking with Smart Delta, Mrs. Azuka Goodness, a beneficiary of the scheme, bearing her child in her arms, stated that she has taken full advantage of the scheme as her child gets free medical attention whenever the need arises under the Children Under 5 policy of the Contributory Health Scheme.
I'm very happy because each time our child is not feeling fine, they normally attend to us quick and also give us the drugs that we'll be using for our child, and after then our children will be fine. Governor Ifeanyi Okowa, I pray that God should bless him with more money so that he may be helping people.
Touring several health facilities within the state, we met with a couple of pregnant women and families who expressed gratitude to the Delta State government whilst explaining how impactful and helpful the scheme has been in providing care for antenatal to post-delivery.
Governor Ifeanyi Okowa has actually tried, because when you go to other states, you don't see such. But here in Delta State, when I came, I noticed that there are so many things that the governor has actually put in place. Some mothers lack one thing or the others. They can't be able to pay for hospital bills and others. But when you come to Delta State, the governor has made it simple that when you come to any primary health care, they can handle you without paying anything.
I really appreciate Governor Ifeanyi Okowa for what he has been doing, because he's really trying for making all these government hospitals working the way they're supposed to work without collecting money for us. So I really say thank you to him.
In one of the accredited general hospitals visited by the Smart Delta media team in Delta North, OKOWA Rita, a 3-month antenatal patient, shared with us her unique experience.
The scheme is very okay. The services, especially the under 5, was superb. The doctors were friendly to the children. At the time, my daughter said, "Mommy, let's stay here." And I said, "No, this is a hospital, it's not our home, we have to go back." In terms of antenatal, I really want to give them kudos. Sometimes I think about the financial aspect. If I were to go to a private hospital for each antenatal checkup, I know how much I would spend on it. But here we come, we spend nothing, and we still get the medical care.
Mrs. OKOWA is, however, not alone. Her counterparts in their different trimesters narrate their experiences. Hear them.
The nurse is okay, they are attending to us very fine. Dr. OKOWA is fine. I'm appreciating him because it's not easy. If I went to a private hospital, I know how much I will spend. But yeah, it's free. I'm so grateful.
Everything in this hospital is free. When it comes to tests, lab, the drugs they give to us, everything here is free. I want to say thank you to our governor, Dr. Ifeanyi Okowa, wish him heaven at last, because what he's doing, honestly, I'm impressed.
It is also pertinent to note that senior citizens and retirees are not left out of the care grid. They equally enjoy the subsidy that comes with their subscription to the state's health scheme.
OKOWA's administration is A+. The reason is this: we're groping with challenges of welfare for workers. And luckily for us, 2015, when the governor came, he brought this proposal of contributory health scheme for workers. And very quickly, Labour mobilized and embraced it. But we saw the clearer picture in what the OKOWA government brought to us as Labour leaders. That while in the other one you pay 10%, in the contributory pension scheme of Delta State you don't pay anything. A director in my own office had his son operated on, and it was free. And I asked him, if those who have not benefited are crying foul today, will you speak for the scheme? He said yes, he will do that.
As a medical doctor acquainted with the challenges that plague the health sector, Governor Ifeanyi Okowa made sure the state's contributory health insurance scheme is designed to provide equity in access to quality health care and also meet the needs of other deficient areas affecting quality healthcare delivery, such as developing healthcare facilities and workforce, in addition to the provision of necessary health services wherever people live.
The doctors, the nurses, everybody, all hands are now on deck because we're trying to make these services very available to the people that really need it in the local government.
Smart Delta.
My husband, no be Tessa be that.
Yes.
Shebi she talk say no money to pay hospital bills. Abi, she no wan pay the money when she dey home me since. Make I go meet her. Tessa, my friend, I dey happy say your pikin don well and you don discharge am from hospital. Tessa, you no wan pay me my money.
Thanks for your patience. I go pay you your money tomorrow morning. Talking about my pikin medical bills, I no pay 1 naira because this OKOWA administration don pay the premium for pregnant women and children from 0 to 5 years.
See as I wish say, na so it still be for adults.
Madam, that one na be equity plan.
Well, you see, this OKOWA administration don't make free medical services available for all residents of Delta who enroll under the Delta State Contributory Health Insurance Scheme.
And not just once, you go pay very small money and you go get free treatment for the whole year. We dey call this one informal plan.
To prevent the burden of having to pay at the point of receiving healthcare services, especially in situations of limited funds, I think I like this informal plan.
Women when register for equity plan under Delta State Health Insurance Scheme when born through CS or vaginal delivery na free medical services.
You see, this OKOWA administration, they pay the premium for healthcare services in Delta. In fact, Market Men and Women Association, they enroll under the informal plan with small money and get free treatment for the whole year.
Na I be say, as I don't get belle so, na to go register with the Delta State Health Insurance Scheme.
As you don't get waiting, join the 7.
Governor Ifeanyi OKOWA, expanding health insurance coverage in Delta State.
Smart Delta.
Also critically important to achieving qualitative healthcare services for all Deltans, the government of the day has revamped and established primary healthcare centers in virtually every federal ward in the state. In addition to these, Senator Dr. Ifeanyi OKOWA has ensured the proper equipping of the facilities with relevant state-of-the-art equipment to meet the health challenges of the people.
This is the lab, the viewing box for x-rays, and this is the theater lab. And this is the state-of-the-art theater operating table.
Governor OKOWA is too much. For a lot of people that were sick that were supposed to go away from our facility, they do come to us based on the fact that when they are coming, they don't come with any money. The only thing they come with is their phone number.
Dr. Senator Ifeanyi OKOWA has been trying on this contributory health scale that they are giving to mothers that are pregnant, delivery, and children. Not only this, so like my road now, if not because of OKOWA, we will not be going to work. He has developed that road in that every day I pray for him.
The Governor Ifeanyi OKOWA-led government has also deployed technology to smoothen the healthcare delivery process and overall experience for both frontliners in healthcare delivery and non-medical staff.
So any position you want?
We have done certain things that can sustain the program because we have actually moved into the level of electronic operations. Most of our operations are electronic, and we try to build bridges here and there to make sure that this thing is sustained, that it lives beyond us. We are actually the best in the whole country.
Because power is also a necessary booster and prerequisite for effective healthcare delivery, the Delta State government, through the Contributory Health Commission, has provided and installed solar systems and inverter handle devices to illuminate the facility and environment in any case of power failure. This has in no small way added value to the quality of healthcare experienced in numerous health centers within Delta State.
We have solar system in all our facilities because we cannot have downtime in our processes. Documents or information are remitted live or part-time in most instances, especially where there is network. So the Commission endeavors to provide these devices in facilities, and they are basically for the lighting points and to power the devices.
Efforts are being made to register people who will be automatically your patient, and there are peculiarities about this social health insurance scheme so that you will know why every patient that comes to you should be treated like a king.
To ensure clinical quality and in pursuance of promoting people-centered integrated healthcare whilst creating awareness for the incorporation of the Universal Health Coverage Initiative, the Delta State Government, through the Contributory Health Commission, working in synergy with the Ministry of Health, ensures proper staffing of health centers as well as embarks on regular training for capacity enhancement and ultimately to keep health providers abreast with the current realities.
Our coming here is 2 days workshop training. It's very interesting. I have learned a lot, especially in the area of creating bills and also being in the health facility to make sure we attend to our people. With this, it will continue. OKOWA, Baba, he has really done a great thing. He's a father indeed.
What we have been doing wrongly, we have now known that we will be able to do it rightly in terms of contributory health scheme. And our patient will be well cared for from now henceforth.
It is indeed delightful to note that Governor OKOWA's passion in ensuring access to quality healthcare for all Deltans also resonates with the people living in far-flung riverine communities. Defying geographical odds and determined to attain the vision and mission of the Sustainable Development Goal 3, SDG 3, the state government has revamped, built and equipped hospitals both in staffing and equipment where hitherto were lacking. Today, testimonies emanating from this region are indeed beams of hope for generations unborn.
I want to appreciate the governor for what he has done for us, because assuming there was no health center in this place, we would have wasted our money to rush down to Warri to look for air. But this time, they have given us health center. To don't stress ourselves again, everything is free.
In the very rural riverine communities, as far as Polobubo, Opoza, Wembury were not very effective, and we developed a PPP program called the Access to Finance Program, where we capacitate reputable private organizations to go to deep rural communities to provide care. The health insurance scheme is for access to quality health care for all residents of Delta State, irrespective of their socioeconomic status or geographical location. That is our mandate, and that's what we want to achieve.
Smart Delta.
Here in Delta State, Governor OKOWA-led administration is on a mission to leave a mind-boggling legacy of transparency and accountability. Despite the plethora of achievements attained in the last couple of years, Governor OKOWA has remained resilient in his efforts to ensure that every member of the society is captured under the scheme. To this end, sensitization as well as registration into the contributory health scheme has been taken to these market men and women all across Delta State.
Una for this market, for some days now, when I would not see person wear this kind of dress, they pass the market. The work when they call do now to make sure say all market men and women, when register with the association, it go register them into the Delta State Contributory Health Scheme. Because now belong to the market women. Now we call informal sector. As then so, mama get ID card. When does show say she na member of the association, confirm. So she go supposed to register free of charge. We'll give her another ID card when go use for the health program.
Recently, Smart Delta roving lenses caught the ongoing registration exercise of some market men and women in one community.
It's a fantastic job for our governor to say market men and women should not pay when they are sick. After registration, they will give you a card. And with that card, you can go to any hospital when you are sick. And after treatment and everything, the drugs they are going to give to you, the governor said, walk away to your home, don't pay. The government has already paid for you. We are glad. Why we no go make it yanga? Why we no go make it yanga? OKOWA na wa papa. Why we no go make it yanga? God bless the amiable governor of Delta State, Ifeanyi Chukwu OKOWA. In Jesus' name.
It has never been like this before. We have always believed that God will send a Messiah to help the market men and women, and this is an opportunity that we are having now. And we thank Governor OKOWA that he provided us with this scheme, and all the market men and women, we are so grateful to our able governor.
Those wey not get money to treat body before, wey go run branch go buy paracetamol 10 naira 20 naira just to suppress the thing first. As free health care don come, everybody go like dey join us too. So it's a good one. E go make our market women and men association, e go make our day well open for everybody, because they feel say nothing dey come. So this one wey comes, I like am. Governor, thank you. Na better thing he bring come.
Enrolled under the informal plan of the scheme, they too can now enjoy access to healthcare and even obtain drugs from any healthcare centers within their districts with little or no cost implication.
This program is running the cheapest informal sector scheme. Let me give you an example now. Somebody paid 7,000 naira for a year and he went to the hospital. He is hypertensive. And the pharmacist called me and said, "Oga, there is this informal sector. Is it that we give them all the drugs?" I said, "Yes, you give them all the drugs." He said, "But this man paid only 7,000 though." I said, "I know. And the drugs I want to give him is 17,500. I said, "Give him the drugs." So it is a gift by the government. So if a government can decide that, so, okay, I know my people, I want everybody inclusive, let them take this. It's a good gift. For that, I would say he has done very well.
Governor OKOWA's doggedness towards ameliorating the hardship of the people and in securing healthcare coverage for all has equally attracted well-meaning private investors such as Chevron Nigeria Limited to throw their weight behind the state government in advancing the quality of healthcare services being delivered to the people.
On behalf of Chevron Nigeria Limited, we donate this and this other item, medical equipment, to support the existing public hospital like OKOWA and Shakelewu for the improvement of healthcare delivery.
We're very happy for Chevron for what they've given. If you look at them, from chemistry, semi-analyzers to fetal Doppler, operating table, and some bedside lockers. So this equipment they've just donated will really go a long way in bringing healthcare to Deltans.
Also, the Delta State government, through its contributory health insurance scheme in partnership with UNICEF, has continued to work together to implement new strategies to enhance the healthcare services.
The contributory health scheme has done very well. They are pace setters. We want to use the model of the contributory health insurance scheme in Delta State, and we want to sell this idea to many of our supported states. They've done very well. The collaboration has been very beneficial to both parties.
All we want to do is to go into communities where healthcare is deplorable or where they don't even have healthcare at all and transform it, creating health facilities that are of optimal level and provide the best type of care, making the people of the community happy and healthy.
Any health center, they don't pay money. You born free, you take medicine free, everything free.
Smart Delta.
It's no longer new to state that the health and well-being of Deltans have remained one of the cardinal focus of the OKOWA-led government since its inception till date. Efforts to advance and enhance healthcare coverage as well as its delivery to every nook and cranny of Delta State under the OKOWA-led administration remains on solid footing. Indeed, the vision of prosperity for all Deltans, even in the health sector, is firmly on course. I am Henrietta Enwerako. Thank you for watching today's episode of Smart Delta. The feedback segment. Question of the day.
I want to ask the state government what they are doing to create more awareness on the state insurance scheme.
Thank you, Mr. Emmanuel. The Delta State Contributory Health Commission has several well-packed enhanced advocacy programs. In the first place, we are looking at branding and training selected market women and men, of course, and even NAPEP riders to carry out enhanced DSCAC advocacy and sensitization activities. Secondly, the DSCAC is also going to have weekly advocacy programs In the Pointer newspaper, we'll have one, and DBS Radio, and our community-based newspapers and online media will also be used as platform for our weekly advocacy activity. Then we also have agents all about the state who will be going from house to house to register everybody in the household.
I want to urge all Deltans and all Nigerians and persons from across the world to continue to watch Smart Delta. They're doing so well. It's a good means of communication of what we do in Delta State. I'm quite excited that they've been getting the information out there. If you want to know a lot about what is going on in governance and development in Delta State, continue to watch Smart Delta. You will definitely be able to get all the information that you require.
Text your questions to 081-211-92133 or send with the hashtag accent to all our social media platforms.
You better run, come to Delta State. Come and see the good things where OKOWA they do. You better run, come to Delta State. Come and see the good things where OKOWA they do. I see your job and work creation in Delta. Make the youth say them highlight OKOWA. I see good roads everywhere in Delta. Make the people say them cola. Everywhere. Come live in Delta. Say me I say. Come invest in Delta. Come explore the potentials of our state.